Thank you, Mr. Speaker. America's at a pivotal point in its history. We hear a lot of claims on both sides that are contradicting. And I want to just talk for a few minutes about some of those claims and just give you some simple truths. We heard all day long today that doctors support this government takeover of health care plan. I brought one of several charts that we're putting together in our office. Nearly 500,000 doctors represented by a number of organizations, including the Medical Association of Georgia, my own medical society, are against this bill. In fact, this chart, this is just the beginning of the A's. The simple truth is that doctors don't support this bill if they're practicing physicians, overwhelmingly. Now, I'm a family practice doctor. My own society, the American Academy of Family Physicians, has supported the bill. They have cut a sweetheart deal where the reimbursement rate for primary care docs, family doctors like me, will be upped a little bit. But what they haven't looked at is all the ramifications of this, which are going to be disastrous for their own practices. The AMA cut a sweetheart deal. It's my understanding that they wanted tort reform, an SGR fix, and 100% coverage. They haven't done very well with that because none of those three are going to be accomplished in the Senate bill that we'll be voting on this weekend. We've heard claims about CBO says it's going to reduce the budget or deficit. Well, the simple truth is they've used zombie economics to get these numbers, because one would have to be walking around in a dead person to believe the economic parameters that were forced upon CBO. A good example is the CBO was forced to score or tell us how much it would cost, where we pay out only 6 years worth of benefits, but we have 10 years worth of increased taxes. The Internal Revenue Service is going to be markedly increased in size and given more authority to snoop into our personal lives. In fact, they're going to hire 16,000 new agents to look at our bank accounts, look at our health records, look at whether we have acceptable health insurance as is deemed by a board here in Washington, D.C. We hear our colleagues on the Democratic side, the far left, talk about people cannot get health insurance or health care. Well, they use health care and health insurance as being synonymous. Well, I've treated many patients during my almost 4 decades of practice in medicine, where I've treated them for free. Doctors all over this country are doing so. And some of the societies look at a government takeover of health care. Maybe they'll be paid for these patients that they're treating for free, and so maybe it's a better deal for them. But they're sadly mistaken. Mr. Speaker, the simple truth is we're at a pivotal point in our history. Or we're going to go down a direction that's going to lead us towards total government control of our lives. And that's exactly what this health care bill, so-called health care bill, that we're going to be voting on, the Senate bill, with all of its special sweetheart deals, the taxpayer-funded abortion, the Cornhusker kickback, the Florida Gatorade, the Louisiana purchase, all those special sweetheart deals, we're going to vote on that by voting for a rule. And it's going to deem that bill to be passed. Deem and pass is what they say. That sounds like an old Western, doesn't it? Deem and pass. The only people who are going to be ambushed are the American people, because the only people who are going to really be benefiting from that bill are government bureaucrats and the politicians here in Washington that are supporting this bill. We're at a pivotal point. The American people have to decide. Are we going to decide between freedom on one hand or socialism on the other? Are we going to look at entrepreneurial market solutions to lower the cost of health care, to cover people who are uninsurable? And we have those answers. The Republican Party is the party of KNOW. The American people can stop this by saying no and contacting their Democratic congressman and tell them to vote no. And we can stop this lead towards socialism and vote for freedom.
Time has expired.